Hi there, I'm Zoe Hirst. I'm one of the doctors. Can I just check your name and date of birth for me?
Yes, Alison Booth, 25th of the 4th, 83.
Okay, and how would you like to be addressed today?
Alison.
Alison's okay. So what I'd like to do today, Alison, is examine some of your lymph nodes, which are like little glands that sit in your neck, your armpits, just down by your groin and underneath your knees as well.
Okay.
Would that be okay with you?
That's fine.
Okay. Have you got any pain at all anywhere at the moment? No. Okay. So it'll involve me just having a general look at you. And like I say, having a gentle feel of these little areas. And if it's uncomfortable at any point, just let me know.
Right.
Okay. So just looking generally at Alison, first of all, she looks comfortable at rest. There's no obvious rash or obvious swelling that's visible straight away. No rashes anywhere that you've noticed at all.
So,
no evidence of jaundice or anything like that. Okay, so what I'd like to do is start with the neck, if that's okay. For each of the areas of the lymph nodes, I'm going to have a good look and make sure I can't see any lumps or bumps initially. That's fantastic. Okay, I'd like to just pop behind you to have a feel of your neck. Is that okay? Okay, so just going to start just under the chin here, so submental. Submental, preauricular, postauricular, down the anterior chain, and supraclavicular fossa. And just look towards the right for me, and towards the left as well. Okay, and just feel that towards posterior chain as well. And occipital. That's great. All right, that's fine. Could I have a feel of and a little look underneath your arms now? Is that okay? Just have a little look first of all. And just let your arm just go floppy for me. No obvious lumps or bumps that you've noticed on either arm. Oops. Okay, that's great. So what I'd like to do is have a feel of your right arm first of all. So if you could just rest your arm onto my arm there. If you can, just let me take the weight of your arm, that's perfect. I'm just going to use this hand to pop it into your armpit. It goes a little bit deep, so if I hurt you, just let me know, okay? So I'm just going to feel right up into Alison's arm. Just, if I need to, just bring her arm a little bit closer to her chest to relax a little bit more, okay? So feel right up into the apices, immediately along Alison's ribs, laterally along the humerus. I'm going to feel posteriorly and anteriorly as well. Okay, that's fine. And just feel the other side now. Again, just let me take the weight of your arm, if you can. And just bring your arm just slightly closer. That's it, let it go nice and heavy. I'm just going to feel again right up into your armpit. So let me know if it's too sore at all. Right up into the apices. Immediately rolling my fingers against the ribs. Laterally against humerus, anteriorly. Make sure I'm not missing anything of the pyramid, and posteriorly as well. It's fantastic. So if it's okay with you, can I pop you on the bed just to have a little feel of your tummy at the same time? Is that okay? So we'll just feel for your liver first of all. Okay, so just take, when I ask you to, just take a nice deep breath in for me, okay? Off you go. Let's get it out. Okay, in. And in. 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 And out. That's great. Okay, I'm just going to tap on your tummy now. That's fine. Okay, I'm just going to again feel over here for your spleen, okay? So again, nice deep breaths in and out, okay? Off you go. And out. And in. And out. In. And out. And in. And out. And in. And out. And in. And out. Few hands and in. And out. Okay, that's great. Great time. Okay, that's fine. I'll just pop this down for you now. Okay, we're just going to have a feel just in your groin here for the inguinal nodes, okay? So ideally we'll expose the patient so you can see the inguinal region really clearly, just to protect Alison's modesty today. We'll just keep her shorts on. So we're going to feel just below and along the line of the inguinal ligament for the horizontal chain. So just have a feel. also going to feel along the vertically by this saphenous vein as well. Make sure we don't miss the vertical chain too. Okay. So that's fantastic. Thank you very much. I'll just have a feel of your legs now. Make sure there's no nose just sitting behind your knees. Okay, so just let your leg go really floppy for me, and I'm going to use my hand just to lift your leg up. Okay, so I'm just lifting Alison's leg and just popping my fingers right into the popliteal fossa. Just checking if there are no popliteal nodes. That's fine. And this one as well. Just let me take the weight of your leg. Right inside the popliteal fossa. Okay, that's fine. That's great. That concludes our examination. Depending now on my findings on history and examination, particularly whether or not there was generalised or localised lymphadenopathy, and if there was any suspicious features, that will determine my next move, particularly if I'm thinking about a 2-week wait referral, or if there's any need for any urgent blood tests doing over the next 24-48 hours, such as an FBC.